when we're going to a prospect or have a client that is fully insured and going to self-funded or some derivation thereof, I like to say anyway, that we're going to have a different kind of conversation with your employees. Who's your insurance company? And they're going to look at us and they're going to maybe pull out their ID card and they'll name off a brand name. And I'll say, well, actually, starting January 1 or whatever your renewal date is, you are the insurance company. Yeah. And you are, and you are, and you are. And I am too. Mm-hmm. I'm part of this ecosystem that we're building for you. So from now on, we're going to eliminate the blame game of you thinking a big pile of shiny money is going to a shiny building in a faraway place. So we're going to hold everybody accountable here. And we're going to give you these levers that you can pull for yourself and make your decisions to give you the best care at the lowest cost. And yes, it is working, ladies and gentlemen. People are getting the hint. And I think the dollars that they're having to pay, they're starting to ask more questions. I think insurance was just something, it was just like a riparian right. Like I get to drink water, or I get to breathe air, right? It's just part of my life. And it's become more than a nuisance. Yeah,
and I think that's kind of a good area that we can circle back on as we wrap this podcast episode up, because it is really important that employers, as they start to embrace these new strategies, that company culture has been, one of those hot topics: recruitment, retention, company culture, trying to enforce that in your employee population so that you can retain these employees, and trying to get them educated and ingrained that, hey, we are the insurance company and we all need to, this is a group effort. Mm-hmm. No one likes being told every single year that either A, your deductibles are going up, or your costs are going up. And that's what a lot of these employers have conditioned their employees every single year. Well, how bad is it this year? Yeah. Am I going to pay more and get less? And that's what's happening. So I think even before that, getting into kind of back to the basics with fully insured plans, and really what that means to an employer. These carrier-based fully insured plans, it's not a surprise that, Blue Cross Blue Shield or United Healthcare, Cigna, Aetna, they dominate various marketplaces across the United States. That give you these, off-the-shelf product plans that, you don't really get to, customize or tweak besides your deductibles or your networks, PPOs, HMOs. But they've built these, vertically integrated models where not only are they, profiting off your premiums, but since they own the network, they own the pharmacy benefit managers, they own every piece of the pie, they're able to capitalize on every area of your health plan. So even though that your medical loss ratio may be very poor and they're raising your rates, they're still making money at the end of the day. In previous episodes, we talked about, them being casinos. The house always wins. Yeah. So a lot of it's just educating the employers on, okay, well, how do I put you in the driver's seat so you are winning at the end of the year and not some insurance company. Mm-hmm. So in basic terms, a fully insured plan is, you get a rate based off of however employees you have. You pay that rate over 12 months. You get no access to data or very limited access to data to know how your plan's performing. And then, your renewal rolls around and it's probably going to be an increase. And you ask why? Well, maybe your broker tells you your loss ratio was bad. Well, why was my loss ratio bad? Well, I don't know. Medical inflation, pharmacy's high, this and that. Really not a clear picture like any other area of that company's business that may be seeing an increase in, cleaning supplies or steel or whatever. Yeah. And, well, they know exactly what they're paying and the value that they're getting. Yeah. Where they could just go shop around for those other items. And they've optimized, their P&Ls. Yeah. But this thing called healthcare just has been one of those things on there that they haven't seemed to figure out. And
it's an emotional transaction, right? You get sick, you want to get fixed, and you're ready to pour Fort Knox on it. And, the other thing of it is that even on the limited data side, you mentioned that, You're supposed to have folks in your organization that have access to HIPAA information, and you sign your business associate agreements and those things. But now what I'm seeing is when I do get the large claims data, it says sensitive diagnosis.
Yeah.
You can fill in your own blanks there, but it's like,
so how do you even properly, know what your employees need? Is it are you dealing with high cost prescriptions?
Yeah.
Are you dealing with mental health? Are you dealing with, weight loss and diabetes and some of those things? So it's like you don't get any data to be able to take action. You're just kind of shooting from the hip and trying to make decisions for your business, and it doesn't work.
It's frustrating on so many levels. But I'm reminded of a movie, Gumball Rally, in 1975, one of the all-time classics. And so these guys all raced across the country, and I remember one of the characters, Raul Julia, was the actor, great guy. And he had a Ferrari, and before he took off in New York City, they were going to Los Angeles, and he took the rearview mirror and he ripped it off the car, the windshield. And his driving mate said, "Why'd you do that?" He says, "What is behind me is of no consequence." And that's a fully insured health plan, because you're looking at everything in the rearview mirror. And so we got to pull off that rearview mirror. And we got to look to the future. And that's what we are able to do, is we can see real-time information, and we can do predictive modeling and all of the things that people have been talking about what they can do. We're seeing it. And so the biggest part is the employee member buy-in, because then they're the ones that help us see ahead as opposed to looking backwards, because telling everybody how bad a year they had without really getting into details is just not going to work anymore.
Yep.
What is behind me is of no consequence.